Kaylee Smith, and today we will be talking about eating disorders, specifically anorexia nervosa. So, what is an eating disorder? An eating disorder is a behavior that is characterized by an intense and persistent interference in a person's eating habits, which leads to distressing behaviors, thoughts, and emotions. It is a serious and often fatal illness. Some of the most common and well-known eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa. It's also known as anorexia, and it's a condition where people avoid food and eat small quantities of specific foods, and it's characterized by severe food restriction. Those with anorexia are often overtly obsessed with body image and weight, even if they are severely underweight. There are two different types of anorexia, restrictive and binge purge. Both of them include people who severely limit the amount and type of food they eat. However, with the binge purge subtype, they may experience binge eating and purging episodes where they eat large quantities of food in a limited amount of time, and it's followed by vomiting, the use of laxatives or diuretics. This condition has a high mortality rate, with suicide being the second leading cause of death. According to the CDC, anorexia is the third most common chronic illness in adolescents after asthma and obesity. Here are some of the symptoms. I discussed most of these in the previous slide. So who is at risk? Like most eating disorders, anorexia usually occurs with other psychiatric disorders like anxiety, depression, obsessive compulsive disorder, and substance abuse. The exact cause is unknown, but scientists believe they're result of a complex interaction between genetic, biological, behavioral, psychological, and social factors. These people may have low self-esteem, perfectionism, high stress levels, impulsive behaviors, troubled relationships, traumatic pasts, or be in high-risk environments. Although hereditary plays a role in why some people are at higher risk, they can also affect those with no prior family history. They can affect people of any age, race, background, body weight, and gender. With this being said, they're most often reported in teenagers and young women. These disorders can develop at any point in a person's life, but they typically arise during adolescence or young adulthood. According to the National Library of Medicine, up to 13% of youth may experience at least one eating disorder by the age of 20. Unsurprisingly, dieting is also a risk factor for developing an eating disorder. This is because hunger affects the brain and impacts mood swings, rigid thinking, anxiety, and loss of appetite. There is strong evidence that many eating disorder symptoms are actually starvation symptoms. Hunger and weight loss can impair brain functioning in vulnerable people, which can help to maintain restrictive eating behaviors and make it difficult to return to normal eating habits. Health complications. Many hold the misconception that eating disorders are just a personal lifestyle choice. However, in reality, they're very serious and can result in heart, digestive, skeletal, and oral problems, as well as malnutrition, gastrointestinal problems, brain damage, and in some cases, death. They can even lead to grave disturbances in behaviors, social functioning, thoughts, and emotions. According to the National Association of Anorexia Nervosa and Associated Disorders, eating disorders are among the deadliest mental illnesses, and they're second only to opioid overdose. A large study by the National Library of Medicine showed that severely malnourished anorexia nervosa patients have had many micronutrient deficiencies like zinc and vitamin D. Those were the most frequent, and it was followed by copper, selenium, and vitamin B. Blood levels of these deficiencies varied depending on the subtype. Treatment. Because of the potential severity of these disorders, they often require the intervention of medical and psychological experts. It's important to seek treatment as early as possible because people suffering from an eating disorder are at high risk of committing suicide and mental complications. Unfortunately, it's very hard for many people with eating disorders to seek treatment because many of them do not think they need treatment or simply do not want it. Since individuals with eating disorders have a high risk for suicide and other mental problems, it's important to seek treatment as early as possible. Depending on the severity and type of eating disorders, treatment include therapy, medical care, nutritional counseling, medication, and hospitalization. Currently, there's no proven method that prevents the development of anorexia. However, after seeking help, it is important to set goals and practice smart eating habits. Anorexia, there's two subtypes. It's characterized by unhealthy food and weight obsession, and it's most common in young women, and it can result in severe health complications.